In Ivan Turgenev's story, The District Doctor, the setting plays an important role in understanding the doctor's challenges and the story's themes. The events likely take place in the 1850s in rural Russia, during a time when medical care was not very advanced, especially in less modernized areas like Russia compared to Western Europe or the United States. This context helps explain why the doctor struggles to save the girl, as medical knowledge and treatments were limited. The girl's family lives far outside the city, which is significant because it shows the difficult journey the doctor has to make to reach them. This distance also contributes to the doctor's growing frustration about having to treat her. The story begins with Shumukin, a district doctor, traveling to a rural area to care for a patient. When he arrives, he is struck by the beauty of the young girl and prescribes the necessary treatments for her recovery. However, despite his efforts, the girl does not improve. The doctor stays with her for a while longer, but it soon becomes clear that she is not getting better. He realizes that the girl will likely die and starts to question whether he should move on to other patients who need his attention. However, after thinking it through and convincing himself with some doubtful reasoning, the doctor decides to stay and continue treating her. Sadly, the girl continues to weaken and dies a few days later with the doctor by her side. The story gives us insight into the life of Yako, the district doctor. He works in a rural community in 19th century Russia and is dedicated to his job. Despite the difficulties of limited resources and a lack of modern medical technology, the doctor continues to care for his patients. His profession demands a lot of his time and energy, yet he never gives up on his duty to help those in need. Throughout the story, the doctor's personal life is also explored. He has a family, including his daughter Masha and his wife Tanya. His work puts a strain on his relationships with them, but his love for his family is clear. This adds depth to his character, showing that while dedicated to his profession, the doctor also cares deeply for his family. His role as a doctor in a rural community comes with personal sacrifices, and the story highlights the emotional toll of his job on his family life. The social dynamics of rural Russia also play a role in the story. The doctor faces challenges with local authorities, including the village elder, who represents the traditional authority. These conflicts show the tensions in the community and how difficult it can be for individuals like the doctor to challenge the status quo. As the story progresses, the doctor's character is shaped by his values such as integrity and compassion. Despite the struggles he faces, he remains committed to alleviating the suffering of others. His dedication earns him the respect of those around him, and the story portrays him as a figure who lives according to the noble ideals of his profession.